We're looking at different methods for reusing, so particularly N95 respirators, and so they are disposable, but they are not single use, and they can be. There's been some studies that have supported that they can be reprocessed, we call it, or sterilized again, or decontaminated from a variety of different methods, and there's been some good studies out of the US about how that can be done. So yes, we are looking at those initiatives here in BC, and there's been some work already, and the federal government is also looking at that and across the country on how we could reprocess safely so that they can be reused multiple times safely.
With respect to procurement and the enormous effort being led in Canada, led by federal and provincial governments and many people in the community, with respect to actions and initiatives of the federal government, there are agreements in place that ensure that that provinces get access to those, and that will continue to happen. And the federal government, needless to say, will ensure that as well, that people who may have urgent need also get access. And so we've been working very closely on issues such as ventilators, but also issues such as obviously PPE with the federal government, and that partnership, I think, in this past week and especially in this next week, we're very optimistic will bear fruit. We
showed you our projections and our modeling and where we're tracking right now, so it's not an urgent, emergent issue for us at the moment. But yes, we have an agreement with the other provinces and territories about distribution of assets that we acquire as a country, and BC has part of that. Obviously, our concern right now is making sure that the areas of the country that are having the most explosive outbreaks, or the increased numbers of people requiring those services, get what they need in short order. So we'll be watching very carefully. We would expect to get some of the allocation once it comes, and you know, it's not it. If we keep doing what we're doing, we may not need them right now, but we may need them with another wave in the future. So all of this is us working together across the country.
We reported yesterday there's new. We've brought both new ventilators and refurbished ventilators into operation in the past 2 weeks. So we now have between 1,400 and 1,500 ventilators, and we're able to as well, if you'll recall the presentation that was made on our modeling and on what it meant for acute care. You saw that we were able to deal with some small gaps that were in place in some regions. So we've taken steps to assign those ventilators throughout the healthcare system, and that's what's going on now. And of course, with our cooperation, our work with the federal government, we would naturally expect a share of additional ventilators that were purchased. But right now our goal is to ensure, by being 100% committed to the measures that have been adopted by Dr. Henry, that our current stock of ventilators will be sufficient.